Two different patients, different outcomes. So imagine one patient having an ulcer in the mouth, and they saw us very immediately, like 3 to 4 weeks. Got the things diagnosed, got the biopsy done, and the treatment was done. It came out to be a oral cavity cancer, the tongue cancer, and was treated with surgery, no other treatment. Patient was absolutely fine after few weeks and again back to the same function which he was before. अभी दूसरी तरफ एक और patient लेते हैं, दूसरा patient which has shown us after 6 months. He had developed ulcer in the mouth, did not choose to see a doctor, spent time thinking that it could be a normal ulcer, treated home remedies, treated some other Ayurvedic medicines or any other alternative medicines, and after 3 to 4 months, when ulcer become large, involving a major part of his tongue, and the lump starts appearing in the neck, at that time they sought our help. So then he came down to OPD, and patient was then advised surgery. It was diagnosed in advanced stage. Surgery was done, which means majority of the tongue was removed along with the lymph nodes in the neck. So the patient had to undergo a plastic surgery, radiation, chemotherapy, everything was done for that patient. So you see the difference over here. Same disease, started at the same point. One chose to act immediately and got away with minimal morbidity. That means the minimal functional problems. दूसरी तरफ पे the same patient which had same disease but waited over a period of time, approximately 3 to 6 months on that, and the disease progressed over a period of few months and had to undergo a very radical surgery, lot of function and speech difficulties, swallowing difficulties, and plus the survival also dropped in a significant way. So when we say staging is not a random fact. It is not a random play of dice. It is something which is in your hand. So early you see the doctor's help, early you seek the professional help and get it treated in the early stages, the cure is much higher as compared to when you go to a doctor or you go to a specialist at the later stage. So when we compare, cancer generally has 4 stages: stage 1, 2, 3 and 4. Stage 1 and stage 2, they are generally called as early oral cancers or early tumors, where the treatment is only one single modality, whether it could be surgery, majority of the patients, sometimes radiation therapy, but again you don't require multiple treatments together and the results are very good. When we say stage 3 and stage 4, these are advanced stage cancers and the treatment is multimodality. That means surgery with radiation or chemotherapy or all three combined, that has to be used in those patients. So that not only gives you the side effects, that not only gives you the functional problem, the functional quality of life gets compromised, but also your survival drops. So just imagine, stage 1 has more than 90% chance of survival and stage 4 has less than 60% of chance of survival. So there's a huge gap in between. So that's why early help or the early consultation with your oncologist is very important.